welcome for joining us. Today we will be discussing noticing and helping with arthritic pain in senior shelter animals. Our presenter today is Dr. Gary Oswald. Dr. Oswald is a diplomat of the American College of Veterinary Internal Medicine and is a board-certified specialist in the field of veterinary intern medicine and many other subjects. Dr. Oswald received his BS and DVM degrees from the Ohio State University. He interned at Oradell Animal Hospital in New Jersey and then completed a medical residency with master's degree in internal medicine at Colorado State University. He has been in private practice since 1991 and is currently the department head of internal medicine and department co-head of emergency services at Tampa Bay Veterinary Specialists and Emergency Care Center. He is the author of multiple veterinary articles and presents continuing education series lectures throughout the United States, the Caribbean, and Central America. We welcome Dr. Oswald.
Hey, Carolyn, thank you so much for having me this afternoon for your lunch series. I'm glad everybody could spend a half an hour with us for lunch today. I'm coming to you from Clearwater, Florida this afternoon. Beautiful sunny day, so we'll go ahead and have fun for this next half hour and see what we can learn about some of our options for managing and treating osteoarthritis in dogs and cats, especially ones that maybe come through rescue organizations or shelters. Let's go ahead and we'll fire up our presentation. I just have two financial disclosures. I am a consultant with the CC Animal Health and also with PRN PharmaCal. You will see products from both of those groups in today's presentation. Okay. Well, guys, I tell you, I've been with Tampa Bay Veterinary Specialist, a practice I started back in 1991. And we've been very fortunate over those years to partner with a number of our local shelters in Central Florida and lots of rescue organizations throughout Florida and even throughout the United States that have brought dogs down to us. So we've been an active partner, and we certainly enjoy working with shelter and foster patients, and I know we get the same satisfaction that many of you do doing a wonderful thing for these pets that need forever homes. So let's take a look a little bit about, many of the pets that come into these shelters and rescue organizations have medical issues. And one of the more common things that we may see is osteoarthritis, especially as dogs or cats become, a little bit more towards their geriatric age group. And osteoarthritis is not just an obvious lameness, as you see here is the top thing. There's tons of different clinical signs or symptoms, if you will, that hopefully we can be picking up on in our shelters or rescue foster organizations that help us know whether these pets that maybe we've just been recently introduced to have osteoarthritis. The big four things we talk about are reduced mobility, reduced activity, altered grooming, and then temperament changes. And reduced mobility is the one I think most people focus on. Again, an obvious lameness is easy to tell when a pet is off on their gait, but just simple things like stiffness in their legs, reluctance to jump up or down onto things, maybe reluctance to stand up in their rear legs in a kennel. If they have a surface like cats do, difficulty or reluctance to jump up onto elevated surfaces, difficulties with stairs. Cats maybe have difficulty stepping up into litter boxes, all things that your shelter staff or fosters really want to look at carefully when they have that pet under their charge. Also, reduced activity, maybe a little bit less obvious when they're in a shelter situation, but again, in foster care, sleeping more than you anticipate they would be, sleeping in areas that are very easy to access, especially for cats, where they don't jump up or take to places where you would normally see cats resting. Again, maybe reduced interaction with people or other animals. Altered grooming is a big one. We certainly see in cats many times that they simply don't groom as much because it hurts to get into those crazy yoga positions like they do with their paws up above their heads and behind their heads and so forth. We also see both dogs and cats that oftentimes excessively groom an area that hurts, like over a carpus or wrist joint or over a knee that's arthritic. And then temperament changes. You can see old Grumpy Cat here. The poor kid passed away last year, but also this is now Grumpy Dog. But temperament changes where these patients are oftentimes very friendly until you go to pick them up a certain way or a certain joint, and then their temperaments change. They become grumpy or, reluctant to have you do things with them. So lots of things you can look at. And for you guys in shelters and also in foster groups online through most of the universities and a number of other organizations, you have osteoarthritic pain survey scores you can take. Colorado State leads in many ways in developing these osteoarthritis and pain scores for both dogs and cats. I'd encourage you to have your staffs go online, find a survey that works for you. So again, that people that are taking care of these pets can hopefully have an interesting observational period where they can determine, do they think these pets may have signs of osteoarthritis that are not just typical lameness. Now, when it comes to treatment, there's a lot of different ways to treat. And the purpose of our talk today is not to get terribly into depth in all the different treatments. I just want to sort of overview what's available to you. As an internal medicine specialist, one of the biggest concerns I have, especially in pets as they get older, is not only arthritis, but also having failures or insufficiencies in other organs, especially their kidneys. And some of the things as far as drug therapies and things we do with our arthritic patients may actually create problems or harm other organs in the body, and we have to be aware of that. So I also want to focus a lot on non-drug therapies that can be of definite benefit to arthritic patients, especially senior patients, and then not create as much stress or problems for organs like the kidneys. So we're going to look at a multimodal approach. We're going to talk a slight time about drugs that both reduce inflammation, which is a hallmark sign of osteoarthritis and pain. We'll talk a little bit about chondroprotectants and the benefits or limitations of those. We'll talk about, again, non-pharmaceutical things, so ancillary treatments and devices that can be used oftentimes in the home or as outpatient therapies to help with arthritic inflammation and pain. And then we'll finish up today talking a little bit about exercise, the environment, and making sure that we do our best to optimize body weight and condition in these pets, as that takes the stress and strain off of joints and keeps them more mobile when you have arthritis. So first of all, let's look at some drugs that are designed for arthritic patients. And this is both in people and animals. Commonly, we use a number of drugs that reduce inflammation based on their blockage of certain what we'll call cytokines in the system that will reduce inflammation and then subsequently reduce pain in arthritic joints. We want to make real clear, especially to lay people, owners, fosters, people that might adopt our pets, that human drugs like aspirin, acetaminophen, ibuprofen, naproxen should never be given to dogs and cats unless explicitly instructed by your veterinarian and appropriate dosages and time limits are discussed with you. So these drugs can be highly toxic in certain situations, especially if they're overdosed. What a person takes is not what a dog or cat oftentimes would take when it comes to the human prescribed drugs. We have lots of drugs in veterinary medicine that are probably better, and I would certainly lean towards using these drugs under the direction of a veterinarian, not using, again, the over-the-counter human drugs. And you know the names of many of these: carprofen, which is Rimadyl, Daracoxib, which is Duramax, Meloxicam or Metacam, Ferocoxib, which is Previcox, and a relatively new one, Grapaprant, which is Galliprant. But all of these are available for use in veterinary medicine to, again, relieve inflammation in arthritic joints and then relieve pain as well. Now, when we talk about these sort of drugs that reduce inflammation, the drugs we just mentioned are considered non-steroidal anti-inflammatories. They don't contain gluco or corticosteroids would be the terms. We call them NSAIDs. NSAIDs are commonly used as dogs get older for arthritic issues. Right now in the United States, it's off-label to use these drugs in cats. We don't have any cat-specific NSAIDs, but in other countries, as you'll see in a second, they're very common. So they can be used off-label and safely in cats under the direction of a veterinarian. Now, the concern with NSAIDs is that they do have other effects. They don't just block cytokines in arthritic joints, but they block things all over the body. And that can result in detrimental effects to kidneys, especially, The gastrointestinal tract can get very upset with these sort of drugs. It can also have dramatic consequences on your ability to clot blood or your coagulation system. And in cats specifically, cats' livers are built different than dogs, and the cat liver has a tremendous difficulty oftentimes metabolizing some of these types of drugs. So again, we want to be very careful. All NSAIDs should always be under prescription guidance by a veterinarian. Glucocorticoids, which are drugs that are considered corticosteroids, you've heard of prednisone, I'm sure, or prednisolone. These are drugs we use for a variety of anti-inflammatory reasons in dogs and cats and people, but they're really not recommended for arthritis. There's too many detrimental long-term side effects when you use these type of drugs. Weight gain, which is not good for arthritic patients. Again, it puts stress on certain organs, your heart, your blood pressure, your kidneys. And again, long-term use of steroids leads to the condition called Cushing's disease and would certainly be inappropriate for use for arthritis. Now, going back to NSAIDs for just a second, just like in people with arthritis, just because you start an NSAID for relief, if you find you get relief from a drug, your dog or cat is better, they may not necessarily need to take that drug every day, just like we might take aspirin or naproxen periodically for arthritic pain. Same thing in animals. You need to observe how that animal responds to these type of drugs and always use as little drug and as infrequently as possible, especially in our senior patients. Now, granted, at some point in time, arthritis may get bad enough that you do need to be on them daily, but in the beginning, that may not be the case. So always as needed and as infrequent as possible. And then there's also a number of other things, again, that may be able to decrease our reliance on these type of drugs. And those are the other things we'll talk about today. Now, specifically as far as cats go, just two quick words. The drug meloxicam or Metacam, it can be used off-label in the United States. It's actually on-label in a number of other countries, Europe, Australia, New Zealand, Canada, all have labels for this in cats. Bottom line is, as long as a cat is eating and drinking well and well hydrated, they should be able to tolerate lower dosages compared to dogs. But again, under the direction of a veterinarian. And another drug you may be familiar with, Onsior or robenacoxib is the drug name, also is available off-label for use in cats that would have arthritis. Again, it's used in a number of other countries and good studies that show that with appropriate dosing, it's a safe drug for stable cats that are eating and drinking well. Okay, so that's what we have as far as NSAIDs go, a variety of them. Good drugs, as long as they're used safely, appropriately dosed. Try to use them as infrequently as possible and only go to use them daily when things get very severe. Now, we also have drugs that block simply the pain response. They really don't do anything to reduce inflammation. And these drugs can be used by themselves for some arthritic patients or in conjunction with NSAIDs. You can see this cat is obviously painful. You can see it in his face. And for him, meow is just me and ow. So he's definitely a painful kitty cat. Now, as far as blocking pain goes, you have both non-narcotic drugs and also narcotic drugs, which of course will rely on, both rely on veterinary prescriptions for these types, but the narcotics require special prescriptions from the DEA. Non-narcotic drugs we'll talk about. Gabapentin is probably one that's gaining popularity in use, usually with NSAIDs for arthritic patients. It, again, it treats and blocks the pain response through a different mechanism than NSAIDs do, so it's a nice combination, and oftentimes it can reduce the amount of the NSAID drug that you have to give. The side effect that's limiting for this drug would be sedation if you take too much of it, but most animals after the first week of being on gabapentin really don't appear sedated. That's really not a big issue going forward. One thing you do want to be aware of, it comes in an oral solution. Oral solution should never be given to dogs because it contains xylitol, which is a toxin and can very badly damage the liver, even resulting in death in dogs. So gabapentin should always be capsular formed or in a suspension that doesn't contain xylitol if it was being compounded by a veterinary pharmacy. But a really nice drug. Generally, again, safe and oftentimes can reduce the reliance on NSAID drugs. And then, of course, if you have significant pain, you may need to use narcotics. Tramadol is a narcotic-like drug, but it has been DEA registered now as a class 3 drug, so it does require a prescription, a controlled prescription from a veterinarian for this drug. One of the big fallacies of this drug is that it's an effective drug for dogs. To be very honest with you, recent studies in the last couple of years have shown that dogs really don't get much narcotic-like effect and pain relief from tramadol. So I would somewhat discourage your use of this drug if you're relying on it for pain. It actually is a fairly good pain control drug for cats, but one problem is cats really hate this drug. It has a very bad taste even when it's formulated. It can cause them to be very dysphoric and confused. Many times they don't eat well when they're on it and even become constipated if they take it regularly. So very honestly, from an internal medicine specialist standpoint, I really would suggest staying away from tramadol. If you really need a narcotic drug because a patient is in significant pain and an NSAID maybe or other ancillary devices aren't effective, I would use buprenorphine. Buprenorphine is an injectable drug. However, it can be given, the injectable form can be given into the mouth and it will absorb across the gums. We sometimes will see mild opioid type sedation or side effects if higher dosages are given, but at standard dosages, most animals act well and they feel better because it is an effective way to help block pain. It's also a very safe drug when it's used in conjunction with patients with other organ issues like kidney disease. So again, NSAIDs, a drug like gabapentin, or if necessary, stronger narcotics would be your standard drugs to use for significantly painful arthritic patients. Just one side note to make, if anybody has or a client or a foster says, hey, I have codeine with acetaminophen that I was prescribed for pain, don't ever use that in dogs or cats, especially cats, as that acetaminophen is very toxic. And again, any of these drugs that are used that are formulated or that are named drugs should always be under the guidance of your veterinary professionals. Now, one of the big things I mentioned before is, again, I'm an internist and I worry about geriatric patients having drug interactions and other organs, especially the kidneys. So one of the big things we look at in older pets is trying to spare kidney function. We certainly don't want to do harm. And NSAIDs especially can be harmful to patients with pre-existing or ongoing kidney disease. We need to be aware of that fact. And that brings us to the point that there's a lot of other non-drug things that we can do for animals that can help with arthritis. You look at cats especially, and they don't like drugs. They don't like things being put in their mouth. Polypharmacy is difficult if you have to give multiple drugs every day to cats. They become adverse to that. Many times it ruins a relationship between a foster or a new owner if they have to constantly medicate a cat. A lot of cats, as they get older, the vast majority of them over 12 years of age have some degree of kidney dysfunction. So again, in cats, we really try hard to go to use ancillary devices that would be effective in pain relief, not necessarily drugs. So as this cat says to you here as he's taking his selfie, please, no more drugs for me. Okay, so what else do we have? Let's talk a second about chondroprotectants, because everybody knows about glucosamine chondroitin, probably one of the most popular supplements ever developed for people and for animals. And let's be honest, it really doesn't oftentimes do that much for patients. When you give this supplement that contains glucosamine, chondroitin, hyaluronic acid, they're all building blocks for joints. And you still have to have cartilage that is effective in your joints for these sort of formulations to help. Most of our patients that show clinical signs have significantly bad arthritis. And quite honestly, whether you give these drugs like injectable Adequan or Cosequin or any of the other over-the-counter type glucosamine chondroitin, in anybody other than early stage arthritis, these drugs or the supplements probably offer very little improvement. They can't hurt, and so it's certainly something that can be given. They won't hurt other body functions, but as we already said, a lot of animals certainly don't like to take these. Other nutraceuticals, though, that do have benefit would be thinking about things like omega-3 fatty acid supplements and another supplement called microlactin. So let's take a look at these, because both of these will reduce joint inflammation and pain. Omega-3 fatty acids are very nice because not only do they protect many organs, skin, heart, blood pressure, kidneys, They also reduce joint inflammation with patients that have osteoarthritis. They also, as I said, improve especially kidney function, which is wonderful. They're oftentimes available in diets. If you're on a prescription diet, they may already contain an adequate amount of these, but if not, they can very easily be given as a veterinary or human product. Again, veterinarians will dose those based on small, large, medium-sized patients. Microlactin is a little bit different. It's a concentrated milk protein, comes from cows that have been hyperimmunized. And what this product does, it's a non-specific inhibitor of inflammation. Doesn't work in the same way that steroids or NSAIDs work. And as such, it's a safe and easy and oftentimes effective way to help patients relieve some of their inflammation with osteoarthritis. Duralactin is a veterinary product, and it's made for both dogs and cats, either as just microlactin by itself, or you can actually get it combined with omega-3 fatty acids in chews. So it's a nice way to give a dog or a cat a treat that would hopefully be effective in making them happy, and then also helping with osteoarthritis. Clinical effects are oftentimes seen within a week to 2 weeks. So it's a nice combination, duralactin with fatty acids I like to use for osteoarthritic patients. Cannabinoids, I don't know what to tell you guys. There's still too many legality issues. Studies are ongoing but haven't been completed. Really, from a veterinarian's perspective, we shouldn't be recommending CBD oils or prescribing them for patients in many states currently. So again, we're kind of at the wild, wild west when it comes to cannabinoids and CBD oil, but I know a lot of our patients and clients end up giving them. The good news is I don't think they are harmful unless you massively overdose somebody. But again, not something we can at this time recommend on a routine basis. Let's look at some devices that again are non-drug that can help with arthritis as well. One of them that's been around for hundreds of years. They've been known that if you combine electricity and magnetic fields, that you can alter what tissues in the body do. Here you see a loop right here. Again, this is one made by a CC veterinary. It goes ahead and it produces a magnetic field that goes out over 10 inches either side of the loop, a nice wide field. Any tissues that are then inside that loop of activity, it'll influence some calcium and nitrous oxide levels within those tissues, and that affects how they perform metabolism, but especially can dampen inflammation, dampen pain transduction, can help with tissue growth and repair. So it's a wonderful thing to consider for osteoarthritis, and in fact, it's been used for decades. It's more recently become, I think, more popular in veterinary medicine, and some numerous studies and reports have finally started to come out. One of the things that our sponsor of today's lecture, Assisi, has been wonderful about is they have started doing randomized, placebo-controlled, excellent veterinary studies to show that there is some benefit derived from the use of electromagnetic loops. The nice thing about them, they're easy to use. They're home therapy. They can be done at home. They don't require a veterinary visit, drug-free, non-invasive, no adverse effects, and certainly can hopefully reduce the dependence on other osteoarthritic treatments. What's really nice if you have especially a shelter or a rescue patient going to a new home, it's a nice way for a new owner to bond with those animals by using something that doesn't hurt and is hopefully effective in helping them. You can see here that these loops come in various sizes, and they can be placed over individual joints for targeted therapies. They can be put over bigger areas of the body, especially in small animals. They can be placed on the Velcro vest so that we can go ahead and assist to put things over more difficult areas in mobile animals like the thorax or the vertebral area. And they can even be put inside carriers in the floor of the carrier in a padded situation to basically treat virtually the whole body in smaller animals. So a really nice way, again, of non-invasively alleviating pain and reducing inflammation and hopefully making a big impact in your osteoarthritis. A couple other things before we finish up. Acupuncture has been known for, again, centuries as a potential way to specifically induce neurohormonal activity to reduce pain in arthritic situations. Here you see a patient getting almost whole body, hips, specific vertebral joint, probably over multiple back areas. Again, here you see stifle and tarsal joints in this dog. Acupuncture is good. I've used it in a number of animals, again, as a nice therapy that doesn't involve drugs. It's drug-free. It is invasive, if you will, because you're sticking needles into the patient. It does require a veterinary visit. And the good things, though, no adverse effects. And again, hopefully reduces that dependence on drugs. Cold laser therapy, pretty much the same sort of thing, does require outpatient veterinary visits, though, not done in the home environment. But again, drug-free, non-invasive, no real adverse effects. But you do have to wear these cool glasses if you're a cat. That's a beautiful one for him. He almost fades right in. And of course, if you're a dog, he looks more like an aviator there. But you do have to go to the veterinary office for this. But again, bottom line, a great way to bond with new animals. It's hands-on, it's not painful, and it does not involve drug therapies. So just to finish up, guys, a couple things, especially for new owners to think about when they get pets that maybe have osteoarthritis. If that pet is over-conditioned, overweight, we do want to encourage weight loss in those patients. We would want you to have a veterinarian or someone in the shelter derive what that plan would be for a new owner to follow. But basically, it's usually a reduction in calories to about 80% of normal, and less than 10% of those calories should come from treats. And again, increased walking if you're dogs, increased activity if you're cats. So it's laser tag, playing with toys, mouse on a stick, food puzzles. Again, get these dogs and cats out, dogs out more for walking. Again, great ways for new owners to bond with their new pets and produce weight loss. We can also modify activity if necessary for patients that are really painful. Physical therapy in veterinary offices, or the use of the water treadmills oftentimes is very nice for patients that have a limited range of motion initially until they can hopefully go through a course of physical therapy. They can get improvement enough where they can get back to doing things then in a home environment. Massage is a pretty nice thing. If you look at this cat here, tell me that he's not eating that up. He loves having his shoulders rubbed. And again, having owners, though, manipulate joints, move them back and forth, gently massage. As long as a pet is receptive to that, it's another nice bonding technique to help with arthritic joints. And then lastly, medical assist devices. Don't forget, we have booties we can put on for dogs that have trouble on slick surfaces, especially prevents that splaying of the legs that we oftentimes see with the weakness and pain that goes with arthritis. The body slings that help us get up and down stairs is very nice for many large breed dogs, and it helps the owners' backs as well by not having as much stress for them. There's plenty of devices that can be put on individual limbs nowadays that are designed, even laser printed, for the actual patient, that can help, if necessary, limit motion and build strength by using bracing. And some of these braces even have pockets where you can put hot or cold packs, which certainly can make a difference with a local joint irritation or inflammation. So lots of things out there that, again, can be suggested that are non-drugs that can certainly help. Modify your environment, make it easier for these patients to get around. Maybe not such a good idea here if you're an arthritic cat to do the invisible stairwell, but anything we can do to make it easier for them to jump up. I told a group a couple of days ago, I have an old arthritic cat here, and we find that he used to always jump all the way up to the sink to drink water. It's been tougher on him lately. So now I, as a man, have to leave the toilet bowl down, the toilet lid, all the way down so he can jump on the toilet and then jump up onto the counter. So we make it a little easier access for him. Okay, guys, that's all we have today. But in summary, again, bottom line is for arthritic patients you identify in your shelter or your foster group, rescue group, start with lesser treatments first and then escalate as needed to drug therapies. Again, drug therapy isn't the end-all, be-all of arthritic patients. There's lots of non-drug therapies for these geriatric pets that can help relieve any adverse drug effects on certain organs, especially the kidney. When you do go to NSAIDs and those type of drugs, make sure they're under the consultation of a veterinarian that knows what the desired therapeutic effect is and whether we need to be worried about monitoring other systems. And then lastly, I always have a special place. I'm a cat household right now, and my cats oftentimes tell me what to do. This guy says no. Be careful with polypharmacy in cats. I think cats oftentimes respond much better to some of the non-drug therapies that don't stress them by opening their mouth and forcing things on them. So guys, that's all I have for you. I wanted to thank Nicole Westfall, Julie Brown, and Carolyn for having me have lunch with you guys today.